Good afternoon, everybody, and thanks a lot to the organizers for inviting me here today. So this symposium is about neuroprosthetics, and then I was wondering what are the major challenges that we are actually facing in neuroprosthetics. And I think one of them is that they are invasive. We have to do surgery in order to implant these devices, and of course this can cause complications. The other one is that maintenance is probably not that good. We all know that, for example, electrode performance degrades with time. And the last one here that I came up with is that they're not really versatile. You have, for example, cochlear implants to focus on restoring auditory function, or you can focus on restoring motor function, but there's no one-fits-all kind of Swiss Army knife-like solution. Now, if I were now to talk about a device that basically works without surgery, that has a lifelong guarantee of working, that comes with a built-in power supply, and that can cover basically all sorts of mental and behavioral functions, you're probably thinking, what the hell is he talking about? And I'm talking about this thing here. Now, I think one of the most important discoveries in the neurosciences of the last decade was probably that we found out that this thing can change throughout lifetime, that it's plastic. And the previous speaker nicely talked about it. And if you want, in a way, you can think about neurofeedback as an emerging technology to make use of this brain plasticity to shape the brain in order to cognitive enhance functions or to restore lost brain functions. Now, what is neurofeedback? We all know that feedback is important for learning, but when it comes to learn to control our own brain activity, we have a problem because we don't have conscious access to our own brain activity. We are simply lacking the sensors for that. And neurofeedback is a simple method to just provide feedback about one's own brain activity, and this allows us then to learn to control the own brain activity. Now, neurofeedback goes back basically to the mid-60s when they trained rats and cats control over individual neurons. And this line of research continues until today. So there's exciting work by the next speaker, Jose Carmena, where they taught rats to control individual neurons in the motor cortex, or they even taught them to control, using neurofeedback techniques, optically recorded calcium signals. Now, if you want to apply this technique to humans, of course, you have to use a less invasive methods here, and the methods of choice that are most often used is EEG-based neurofeedback, or now more recently fMRI-based neurofeedback. And the principle is always the same. You basically extract some sort of feedback signal, some brain signal, then you prepare a feedback signal that you show to the participant, and with the help of the feedback signal, then the participant can learn to control that brain signal. So as I said, I'm working with neurofeedback based on real-time fMRI, and a typical neurofeedback experiment based on real-time fMRI looks like that the participant or patient is in the scanner, then we extract the brain signal, we prepare some kind of feedback signal that is then shown again to the patient in the scanner. So if you were to take part in the real-time fMRI neurofeedback experiment, you would comfortably lie in the scanner, and then you would see this feedback signal here on the right-hand side, let's say a thermometer. At the beginning, the target level would be low, which indicates to you that you should relax, and then your brain activity in the targeted brain region would fluctuate at low levels. Then at some point, the target level will increase, and that indicates to you that now you should try to increase brain activity in the targeted brain region up to the target level. And with the help of the feedback signal, and by trial and error and through learning, you will eventually manage and learn to increase indeed brain activity in the targeted brain region up to the target level. Once you have voluntary control over your own brain activity in the targeted brain region, the interesting question to ask is then, of course, how does this voluntary control over brain activity affect perception or behavior? And in a way, what you're doing here is similar to the TMS or pharmacological intervention. You treat brain activity as the independent variable here. You change brain activity, and then you measure behavioral or perceptual changes dependent upon arising from this manipulation of brain activity. Now, here's an overview over just some of the studies that have been successfully targeted brain regions using neurofeedback based on fMRI. This is by far not complete, but it illustrates nicely that there's a variety of brain areas that have been successfully trained. There's motor sensory regions, there are motor regions. You can also see there are regions involved in emotion processing, in memory, and also primary sensory areas. And the interesting thing is that basically most of these studies showed that such training of these regions causes specific behavioral changes that are relevant or that are related to the function that this region of interest is usually serving. So here's an example of a study where we trained participants to increase activity in the visual cortex. You can see here the region of interest in the visual cortex that we targeted, and the study design was similar to what I've shown you before. They saw as a feedback signal a thermometer display. We had two conditions here, a baseline condition where the target level was low, and an upregulation condition where the target level was high. Now, these participants in the study here, they came to the lab 3 times on 3 different days for about an hour each, and then they took part in several of these neurofeedback training runs that last approximately 10 minutes, and that are composed of, let's say, 30-second baseline blocks interleaved with 30 seconds upregulation blocks. And you can already see here, this is midway through training, that this participant already has kind of some control over the feedback signal. You can see there's some increase during upregulation blocks compared to the baseline blocks. Now, if you look at the group here, you can see that indeed 7 participants learned to increase their visual cortex activity across training runs here. So this is the increase, this is the signal difference in the upregulation blocks compared to the baseline blocks. What you can also see is that we had 4 participants who did not learn to control their brain activity, their visual cortex activity. So this is not an uncommon finding. People vary in how well they can learn to self-regulate brain activity, as we vary in other skill learning sets as well. And you can also see that in the control group that received feedback from a different area but not the visual cortex, they did not learn to control visual cortex activity. So you need feedback from the visual cortex, from the targeted brain region, in order to learn to control that region. Now, interesting is here, of course, then the behavioral effect. And here you can see clearly that the participants who learned to increase activity in their visual cortex, their visual sensitivity improved significantly. And this effect is not the case for the control group of the non-learners. So again, what I want to emphasize here is what we did is we changed brain activity here, and then we measured a change in perception arising from this manipulation of brain activity. Now, we have used similar approaches, for example, to train upregulation of the supplementary motor area. You can see here that when they learn to increase activity in the supplementary motor area, they respond faster in the motor reaction time task. And you can also use this technique, for example, to down-regulate activity. For example, here, down-regulating activity in the parahippocampal cortex also affected, in this case, memory for words. Now, so far so good. This is, of course, kind of nice as a basic science tool, but at the end of the day, what you want to do is you want to bring this to the clinics in order to help patients. And I want to show you an example of a study here, a pilot study that was done in hemispatial neglect patients. You all know that hemispatial neglect is due to damage most often to the right parietal lobe, and the symptoms include basically the lack of awareness for the control lesion on the left side of space. If you asked these patients to copy this image here, this drawing here, they would only draw the right-hand side of the image, but ignore the left-hand side. Now, if you want a kind of very simplified way or model for how these neglect symptoms arise, is that in the healthy case, the parietal cortex here usually serves to enhance visual processing in the contralateral left visual field. And due to the lesion, this enhancement is gone, and this causes then the neglect symptoms. And the simple idea here is that we use neurofeedback in a similar way that I've shown you before, where we trained visual cortex, now to train them to increase visual cortex activity here, and thus to alleviate the symptoms, to basically boost visual processing in these patients. So this is a study that was actually done here by Fabien Robineau in Patrick Guillemets' lab, and as I said, it's a pilot study so far in 6 stroke patients. They all had left hemispatial neglect. The study was done 8 months after stroke onset, roughly 60 years of age, and you can see here an overlay over the stroke that they had, the lesion that they had, and they received feedback from the right visual cortex. The design is a fairly standard neurofeedback design, so basically first you determine your region of interest in the visual cortex, then you do some pre-training clinical assessment with these patients. They come to the lab for 3 times on 3 different days, and they practice for about an hour each day. And the typical neurofeedback training run is composed of, let's say here, 20 seconds baseline block, interleaved with 40-second upregulation blocks. And then after neurofeedback training, you again do some clinical assessment of these patients. Now here you can see that indeed all 6 patients learned to increase their visual cortex activity within these 3 one-hour neurofeedback training sessions, and that's quite good. But what was quite remarkable was actually the behavioral effect. So here you can see the neglect severity score in the acute phase right after the stroke, and then here again, just before the neurofeedback training, which took place, as I said, 8 months after the stroke onset. And you can see here that 3 weeks of neurofeedback training caused a really significant reduction of the neglect severity score in this patient group. Of course, this is a very small sample size, but still very encouraging, and Patrick Guillemets is, of course, now looking into that in more detail and following up on these exciting results. If you go a step further and think about the treatment options that you usually have for these patients, then there's caloric stimulation, neck vibration, TMS, or prison adaptation, and most of these techniques, they basically focus on compensating altered interhemispheric asymmetries. And that's something you can actually also do with neurofeedback. Here you can also train these participants to learn to control the interhemispheric balance between the left and the right visual cortex. And the way you do that is by using differential feedback. So instead of training only one region of interest, we now define two regions of interest, one in the left, one in the right visual cortex. And then you provide as a feedback signal the difference between these two regions. And the participants can then learn to control the interhemispheric balance by controlling this differential feedback signal. So we did a pilot study in 40 healthy participants, same design as before. Now, as I said, now we define two regions, one in the left, one in the right visual cortex. And again, they came to the lab on 3 different days and did a couple of neurofeedback training runs here. And you can see, indeed, it is possible here to learn to control the interhemispheric visual cortex balance with the help of differential neurofeedback. And what was also interesting to see, and especially for clinical applications, when we asked some of these participants to come back after a year, they still could do it, indicating that this effect, what they learned, it's a learned new skill that is maintained for at least a year without further training. Unfortunately, though, we haven't yet succeeded to bring this to the neglect patients, so they seem to, at least in the few patients that we had so far, they seem to struggle to learn to control the differential feedback signal, so there's still work to be done here. So just to summarize these kind of region of interest-based neurofeedback approaches, I've shown you there's a variety of brain function that has been trained. You can use it, for example, to manipulate perception or other things and apply it to visual neglect symptoms. You can also use differential neurofeedback to manipulate the interhemispheric visual cortex balance, and such training produces lasting effects. But of course, we all know that most mental functions and also most mental disorders are associated not just with region of interest, but with interplay of different regions and with network activity, basically. If you take the example of visual processing, we know that visual processing is due to an interaction of multiple interacting brain regions, or if you take the case of depression, we know that depression is also associated with a lack of inhibition, top-down inhibition from the prefrontal cortex onto limbic structures like the amygdala. And that's why we spent quite a bit of effort and developed something called connectivity-based neurofeedback. I won't go into the detail here about the method. We use dynamic causal modeling, which is basically a mathematical framework to describe connectivity patterns in the brain. And this now allows us to manipulate brain connectivity in health and disease. And the first time we applied this new method is now to learn control over emotion networks. We all know that learning to regulate or knowing how to regulate emotions is very important for our well-being, to deal with events, positive and negative events. And if we fail to do so, this can, of course, result in burdening affective disorders. Now, the neural underpinnings of emotion regulation have been intensely studied. If you want a very simplified model, very, very simplified, is that it is associated with the control of stimulus-driven bottom-up responses from the limbic cortex that are shown here in red, through cognitive top-down processes that originate in the prefrontal cortex. And the goal of this study was simply to increase the cognitive top-down control of the prefrontal cortex over the amygdala. And this, again, was a pilot study in 15 healthy participants. So here you can see that, indeed, over the course of, I think, also 3 days of neurofeedback training, participants indeed learned to increase the top-down control, whereas participants in a control group that received sham feedback, meaning they received feedback values not from their own brain, but we replayed feedback values from a previously tested participant in the experimental group, they did not learn such control. As before, once they have learned to control, to increase top-down control, once they can exert that skill, they can also do so in the absence of neurofeedback in so-called transfer runs, where they do the same thing, but we don't provide feedback information anymore. And also, interestingly, such training caused an increase in valence rating of emotional stimuli. It's not a big effect, but it has some behavioral effect as well, it looks like. And it is also associated with the changes in activity, not just connectivity, but also in activity. So here with a decrease in amygdala activity and an increase in prefrontal cortex activity over training. So to summarize the study, indeed, with the help of connectivity-based neurofeedback, you can learn to increase top-down control in emotion regulation networks. Once you have learned this, the skill can be maintained without neurofeedback. It affects mood, and it comes along with concomitant changes in brain activity. Now, of course, in the next step, we want to apply this to emotion regulation disorders, which are often characterized, as also the previous speaker said, excessive bottom-up processing and hyperactivity of the amygdala, shown here in red, and insufficient top-down inhibition and hyperactivity of the prefrontal cortex. Now, the last example of the use of neurofeedback that we and also others are following up is, I want to present here, is using neurofeedback to control neurotransmitter centers. Of course, with fMRI, you have no chance that you can in any way measure neurotransmitter release or anything like that, but you can use neurofeedback to learn to control activity in neurotransmitter centers and thus indirectly also learn to control the release of neurotransmitters. So for example, there are studies showing that when you train participants to upregulate activity in the VTA region here, which is a dopamine releasing brain area, then not only the VTA lights up or becomes more active, but also other dopaminergic regions such as substantia nigra, hippocampus, and prefrontal cortex also become co-activated, indicating that there might be a spread of activation through dopaminergic innervation. Now, if you have, of course, a tool that would allow you to control dopaminergic brain centers, then this can be, of course, quite relevant as a new experimental strategy for addictions. And that's something that is particularly relevant for Zurich, where wastewater analysis have shown that Zurich is probably the city with the highest cocaine consumption in the world. But Geneva is not lagging far behind that. So we did some preliminary results of a study that we did in collaboration with Markus Herden and Matthias Kirschner, where we trained basically 28 healthy controls and also 25 cocaine addicts to increase activity in the VTA area with the help of neurofeedback and positive rewarding imagery. And you can see that compared to before training, they all learned to kind of increase activity in that area. And these are sort of very encouraging results because there are studies that suggest that basically in cocaine addicts, nothing basically helps them to activate reward centers. And here we see that indeed with neurofeedback, they can learn to control activity in these dopamine-releasing brain areas. And also here, as I've indicated before, this is the region that we trained here, the VTA region. This is the region of interest where they got feedback from. But when they increased activity in that area, they also co-activated other dopaminergic areas such as the striatum, hippocampus, and areas in the prefrontal cortex. And currently, as I said, it's preliminary results. So currently, we're now looking into, of course, behavioral effects of that training in these patients. So I just want to conclude with a few sloppy comments. I think we're all funny creatures, all governed by this big, big head, and we're making funny sounds and funny movements. And this head has this brain has a lot of buttons to press and lots of adjustment wheels to turn. And I think neurofeedback is an interesting way to turn a few of these adjustment wheels to see how the system behaves differently. And if you think about, I think it's also a very intuitive way of approaching this, because what would you do if you have such a VCR where you don't have the manual and the labels are in a language that you don't understand? You would probably start pressing buttons. And now if you think about the ways we have to press buttons in the brain, then of course we have psychotherapy, which is a very important clinical tool, but the biological foundations are not very well understood, and it doesn't work for everyone. We have medication, which again is very important, again doesn't work for everyone, and can have severe side effects. We have neurosurgery, which is kind of invasive, and we have tools like TMS, which are also very interesting, but also here you cannot, for example, penetrate deep brain structures. And neurofeedback, I'm not saying neurofeedback is the best way, but it's especially based on real-time fMRI, it's around only since about 10 years or so. It's a very new emerging technique here, and it has all the methods have the pros and cons, but we came a long way already, and we're at the stage where we now can go to larger scale clinical trials because we have interesting pilot experimental effects. And I think it will be interesting to find out how far we can push this approach, both in terms of basic science, but also in terms of clinical applications. And if you think of neurofeedback as a novel experimental therapy, I think it has a few points that are interesting about it. First of all, it targets psychological aspects as well as biological factors. So you're dealing here with learning strategies, with mental strategies, but you're also changing brain activity or brain connectivity. It is compatible with any other conventional therapy. It is non-invasive and safe, and it produces lasting effects. There are more and more evidence showing that these effects will last for months and years. And it can also be personalized to the individual needs of each patient in terms of brain structures that you target and also in terms of learning objectives. And I think most importantly, it builds probably on a fundamental human capacity, which is simply our ability to learn. So it's kind of learning for self-healing. And I just want to thank my collaborators here, and particularly here, Fabien Robineau, who worked on the neglect study, Yuri Kusch, who did the connectivity-based feedback, and Matthias Kirschner, who worked on the cocaine addiction project. Thanks for your attention.